at the simplistic level of this, your daughter just has a very, like Leslie said, rusty kind of right brain. And for these kids these adolescents, because I've had those cases over the years where you have these 15 and up, 15 to 25-year-old. It's such a relief for them to realize that they like. I remember my assistant that works in my office now, and when she's 24 and she at 19 was brought to me by her mom, and she's like, "You're our last hope. If you can't help her, we don't know if anybody can help her. We've tried every type of medication under the sun to control her OCD." And they got to the point where they couldn't even keep soap in the house because she would wash her hands so excessively to where her skin would just literally peel off her hands. And then she just had these phobias, and she'd have to wear gloves nonstop because she would never want to, get her hands dirty either. And so, and as I went through her case, I mean, she was originally diagnosed with cerebral palsy early on in childhood, but then, right after that came the ADHD diagnosis, tic diagnosis, an OCD diagnosis. And I remember talking to her mom and saying, "Listen, at the simplistic level of this, your daughter just has a very, like Leslie said, rusty kind of right brain. And if all we do is just start treating into that right brain over and over and over, I feel very confident that we're going to change your daughter's life." And so we did, and we spent about 9 months working on her. And after that, she was so thankful that she says, "Do you think I could come just hang out in your office and help you with some other patients?" And I said, "Sure." And to this day, she's been helping me treat patients.